Hi, my name is Leilani Molina, and I will be talking to you about HIV and AIDS. So, from the time that we discovered HIV and AIDS up until now, there has been some new information, and it has resulted in better care and better survival rates of people that have HIV and AIDS. So, HIV and AIDS show that pulmonary manifestations of HIV and AIDS remain primary cause of mortality and morbidity rates. HIV positive patients don't really have complications with breathing. They don't have no symptoms. They don't have any problems really, but nonetheless, they are a part of a disease that has respiratory complications and infections. Some of the complications include intestinal pneumonia, Kaposi sarcomas, which is like little lesions that grow under the skin, all over the skin. They don't have a primary or a source like that they stick to, like the liver or the kidneys. It's all over the skin, no specific area or nothing. As well as neoplasms, which is new lesions as well, and lymphomas. Radiographic imaging also plays a big role, because if we don't take the image and see what are the criteria that we see in the image, we won't know that it's HIV or AIDS. Like, you're not gonna know, because the complications that they have can be complications of other viruses or other diseases. The lungs are the primary organs that are targeted by HIV and its related diseases. Research documents that about 70% of HIV patients develop at least one respiratory issue during their illness. The radiology is employed to image the viral load and the CD4 cell counts. The CD4 cell counts are T cells. When you get HIV and AIDS attack your T cell count, which is like your white cells. And what do white cells do? They attack anything unfamiliar to your body. Anything that's alien-like to your body, they attack it. So if HIV and AIDS attacks your T cell counts and your white cell counts that it's supposed to attack the HIV and AIDS, how are you going to live with it if you don't take your proper medication? The radiologist, to help the doctor find out if you have HIV or AIDS, can take a chest x-ray. A regular routine chest x-ray. Hold your breath when you're about to take it in. Don't bring up your shoulders, all of that good stuff. The radiologist will be able to see it. They can also take a CT, a high resolution CT, to make sure that there are no little lesions on your lungs. Because when you take a CT of HIV or AIDS, if you're not paying attention, you can't really see the little lesions. Like, they're very small lesions on the x-ray or on the CT itself. With pneumonia, the typical radiographic representation of pneumonia in AIDS is similar to HIV in a negative host. Like, similar to that of a HIV negative host. However, in HIV positive hosts, pneumonia shows a rapid progression and has frequent bilateral disease or multilobar. In addition, the imaging HIV and AIDS by radiology scan may show cavitation. Note that cavitation suggests fungal infection, necrotizing pneumonia, or tuberculosis. Another possible observation of the imaging of AIDS is hilar lymphadenopathy, lymphadenopathy. That this is suggestive of malignancy, and tuberculosis or HIV may induce it. Conclusively, this paper documented, and the video documented, about how HIV and AIDS are viewed inside of the lungs of HIV positive individuals, and how the infection appears inside the body. The study showed that HIV and AIDS could be scanned in pulmonary organs using a chest x-ray. Moreover, radiologists use MRI, CT, high-resolution CT to view HIV and AIDS. The doctors will see bacterial infection associated with HIV and notice their progression in the body. Notably, bacterial infections caused by HIV appear differently and progress differently from the same infection caused by other health issues. Therefore, it is simpler for medical professionals to identify whether these infections are related to HIV and AIDS. For my last note, I would just like to say that there is this stereotype that only gay men used to have HIV or AIDS. Nowadays, we've learned that anybody can get HIV or AIDS if they're not protected, or if they're just not safe with their person or with whoever. So I just wanted to say, make sure you're protected, make sure you get tested, and make sure whoever you're with gets tested as well. Thank you. The CT will show a ring shadow and tram marks. Besides the bronchial walls thickening, the high-resolution CT will detect any tiny airway disease and bronchiectasis. The bronchioles will show mucus impaction,